We have a patient here who comes with a nice mixture of different components to the pathology. As you can see here, these are very large, deeper veins, and this is what we call the accessory saphenous vein, which is anterior. And this is a varicose vein. You see how it's dilated, it's blue, it's deep, and goes all the way down here, all the way down here. And then the interesting part is that around here, you see that the configuration of her veins is a little bit different. These are very superficial. They're kind of purplish, and these are called reticular veins by definition. And then a little bit lower down, you have these very tiny little spider veins, which are the scientific term for this is telangiectasia. So she has a mix of all the range of features for varicose veins. So when we talk about spider veins, we talk about these ones. And when we talk about varicose veins, we talk about these ones. These usually are caused by a deeper problem, and this can be an isolated superficial problem that we can treat with injections. And over here, this is also a nice network of reticular veins, right? There's usually a feeder vein down here. So this would be a perfect patient for sclerotherapy. We would treat that with sclerotherapy. Right here, we've decided to do a duplex on this patient, which is an ultrasound, because she has fairly significant varicose veins. And the question we have is, what is the source of the problem? And the only way to find out is to do a formal duplex. The femoral vein, the deep system, and then you have the saphenous vein, which is coming to join the femoral vein. So here we have a patient that comes in with, as you can see, kind of diffuse looking veins, and they go all the way up to the inner thigh, a little bit here in on the calf region, and also in the ankles. We can treat her directly with sclerotherapy. And as you can see, there's a pattern. So you see it kind of spreads like this, like a fan-shaped kind of pattern. So that typically tells us that there's a feeding branch behind this. And I can actually see it. It's right here. And it feeds right over here. It's hard to see because she's tan, but we have to treat that to make sure that this doesn't come back. So what I usually do is just treat the feeder and then go from the top here and inject all these branches like this.